All right, welcome. My name is Casey Rosenthal, second year med student at Netter School of Medicine, and I'm going to be showing today how to do a proper immunization for a baby. Boo here is going to serve as my baby, and just as some heads up of some supplies that you're going to need. Hand sanitizer, you always need to keep your hands clean. This is our vaccine, which is going to be instilled intramuscularly. It's not actually a vaccine, but it's going to pretend to be ours for today. You're going to need a syringe with an extra needle, and then some gauze, an alcohol prep pad, and a Band-Aid. And so the first step, and this is done before you actually are in the patient's room, you need to drop the vaccine. So you grab the vaccine, you actually should wash your hands first, right? All right. Normally this is actually pretty heavily attached, so you pop it off, throw that away, and you take your needle. Ideally this would be a sterile needle. Carefully you stab your syringe into the rubber component. I had a bit too much caffeine, so I was shaky. And you actually want to push, you want to have some air in the syringe first to push in, and then you want to suck out. Again, our fake vaccine today is Mountain Dew, but ideally you would not put Mountain Dew into your child. You would then make sure that this wasn't expired. It's not. You would throw it away. And carefully, since this needle has been used already, it does not feel good going into a baby, so you actually throw this away. So this would go into your designated sharps container. Next, you're going to grab your new needle. Before you put your needle on, you want to make sure you get all the bubbles out. Get the plunger up. And you carefully screw this on and leave it protected until you actually go to the patient. So now we're gonna go to our patient's room. Here's our patient. We're gonna wash our hands again since we've now encountered them. And at this point, you kind of want the parents to just handle the patient. I'm actually gonna ask for a volunteer to be a parent for me. So you can, James, you can be the parent holding the baby. And while he's taking care of the baby, I'm getting my gauze pads ready. I'm opening my alcohol prep pad, and I'm ripping this off so that I have my Band-Aid ready to go. All right, now I should engage the parent. We've already gotten consent. The parent's cool with the injection happening. So actually, if you could stand on that side, this will be a little easier to get a good view. Fortunately, Boo does not have the perfect anatomy for this, but we're going to use him. And you have the baby on their back. Ideally, the parent is holding onto the arms. And then I hold the legs down. With a real baby, you actually lean against them to keep their legs down because sometimes they will kick. I want to prepare the area, so I'm going to use this side of my gauze that has the alcohol prep pad, wipe it down, and then I'm going to dry it off with the gauze pads. If you don't do that, it's going to sting, and the baby's going to cry even more. And then you encourage the parent to distract the child. So please, play with Boo, play with Boo. I'm going to aim for the vastus lateralis. Put it in, push, push, push. Baby screams. Put that out quickly, cover it with the Band-Aid. Now I give the patient to the parent coddles the child. I carefully cover, ideally with the scoop technique, but I did not this time. This is ready to go in the sharps. And then, since the kid was so great, you give him a sticker. Good job, Boo. Hopefully that was instructive, and thank you for watching.